Your Excellencies, distinguished delegates, ladies and gentlemen, a very good afternoon. I am Dr. Pem Namgyal, DPM from the WHO Southeast Asia Regional Office, and on behalf of my Regional Director, Dr. Poonam Khetarpal Singh, who was looking very much forward to be part of this, but unfortunately due to a conflicting calendar, she is unable to do so. However, we shall hear later her video recorded opening address. I would like to offer a warm welcome to Your Excellencies, particularly His Excellency Dr. Mintwe and His Excellency Dr. Tirawan Agus Putranto, the Minister of Indonesia, and Dr. Mintwe, who is the Minister of Myanmar, for sparing your time to be with us this afternoon. It gives us great pleasure to have you with us, and it is an honor and emphasis and the kind of attention that you are giving to this particular issue. As you all know, December 1st is celebrated as the World AIDS Day, and this year's theme for the day is Global Solidarity, Resilient Health Services. And to link that with the current situation, the theme for today's high-level leadership meeting of SEARO is titled Maintaining Essential Services in Times of COVID-19, Sustaining and Reinvigorating Public Health Response to HIV in the Southeast Asia region. I think this has become all the more important given the impact that COVID had not only on HIV and other programs, but in all of our lives for this year. And therefore, this is a very important issue to discuss, and I look forward to a fruitful discussion and your valuable guidance and advice to us on how we go forward. With that, may I now request the opening address of the Regional Director be played. Thank you. Yes, now we can hear you.
Thank you very much. This has been the year of the global COVID pandemic, so a few technical glitches are not going to be the big problem that we have been facing already. So without further ado, in the next 10 minutes, I would like to take a high-level stock take of where we are in the AIDS response in our region. 2020 was the year when we should have made significant progress towards midterm targets as part of ending AIDS in 2030. Where are we today, and how are we going to make sure that the gaps that we are faced with can be addressed going forward? Next, please. Our region is a very, very specific region in terms of where new infections of HIV come from. They are amongst key populations, vulnerable populations. Globally, a lot of the new infections come from these key populations, but in our region, in the Asia and Pacific region, it is 98%. That means that unless we really address primary prevention and we really address the laws, the policies, as well as some of the social relations that affect vulnerability and make these people the most vulnerable, we are not likely to be able to make much progress towards ending AIDS. The report of the Global HIV Prevention Coalition states, too many countries have not taken advantage of proven methods of preventing HIV and have not addressed social relations, policies, laws, and stigma. And these continue to heighten people's vulnerability. End quotes. Next, please. As a region, infections, new infections, and the reduction in them has been very, very limited. And if you look at the data from 2016 onwards, this has very much plateaued. Only a 24% reduction has been seen since 2010. And what that translates into is just a 2.4% annual reduction. To put this into perspective, ladies and gentlemen, in a country like Myanmar, we saw a reduction in TB incidence of 5% each year. But for HIV, we do not see the same progress. Next, please. Next, please. So where are the gaps? Globally, the plan was to have a 75% reduction in new infections by 2020. In our region, in SEARO, we made progress, about a 24% reduction. That leaves us a gap of 51% between now and the end of December. We need to be able to cover this 51% gap, which is just not possible. So we really have a massive gaping hole in terms of the progress towards incidence reduction. Globally, this gap is 56%. Next, please. If we look at mortality, again, we face a really grim picture. In our region, we made progress, 27% decline in mortality in the period 2010 to now. Globally, the reduction has been 37%. In order for us to meet the goal in our region, we have to avert at least 67,000 deaths between now and the end of this year. Again, a really massive gap, and all the more problematic because we are the region where cheap HIV drugs are produced. We are the pharmacy for the world, and yet in our own region, we continue to see really huge gaps in mortality reduction. Next, please. A key component of what happens to mortality is coming from ART coverage. And globally, we have a 67% coverage of ARVs. The gap globally is 14%. In our region, it is 21%. We have a 60% coverage. And really, the plan was that we get down to 51,000 AIDS deaths by 2020. We are at 110. So we really need to be doing much more in terms of ARV coverage. And this is within our hands. ARV drugs are cheap in our region. We can treat for less than $100 per year per patient. Next, please. You may have heard of the 90-90-90 cascade. The first 90, as we call it, is testing. The second one is treatment, and the next one is called retention. And again, in our region, we see that there is a significant leakage in the cascade. 13% people still don't have access to knowing their HIV status in our region. 21% of those who know their status are not on treatment. And that is a huge gap, 21%. Out of those who are already on treatment, 19% are not getting viral load annually, and we do not know if these people are failing treatment or whether treatment is successful. So we really need to be doing much more in this area, and we need to be putting 790,000 more people on antiretroviral treatment in our region in order to really plug the gaps that we are facing. Next, please. How has COVID impacted the HIV response in our region? Let me start by saying that all member states, despite the challenges that COVID brought to the region, really ensured that everybody who was on ARVs continued to get their treatment. Multi-month dispensing was ensured everywhere, and a key part of the solution to making sure that people had their drugs came from the community, came from outreach workers. So really good examples of countries working, national programs working with communities to give people antiretrovirals, but also to ensure that drug users were able to get opioid substitution therapy, et cetera. However, I would like to draw your attention to the gaps in diagnosis as well as ART initiation. The red line that you see, the 0%, is comparing the monthly figures from 2019 and how they are in 2020. And in each of the 5 high burden countries in our region, you can see that those figures dipped all the way to minus 60%. And in one country, this is probably reflecting the second and the third waves of COVID, we are seeing that we are getting another decline even in October. And this may also happen with some of the other countries. Only one country is showing recovery in terms of ART initiation. Everywhere else, we happen to be straggling by at least 50% behind the figures from last year. So what can we do? Next, please. Our first message and our plea is to really enhance primary prevention by strengthening key population interventions. This is an epidemic of key populations, and a fourth of all new infections are coming in young people between the ages of 19 and 24. So we need to be doing much more for young people, and we need to be focusing on primary prevention. Clearly, we must optimize and fully utilize all our tools for HIV testing, whether it's self-testing, whether it's community-based testing, early diagnosis and treatment using the ARVs that we have in the region, and using the best ARVs that are available, including dolutegravir, which has become very affordable now, not just for adults, but also for children. We must work towards resilient and sustainable health systems. Countries that have done well with COVID will also do well with HIV, as long as we continue to support health systems and ensure integration of HIV programs and decentralization using a primary healthcare-based universal healthcare approach without losing the programmatic and technical focus that all disease elimination programs need. Our next plea and request is to really work with communities to combat stigma and discrimination. When key populations do not feel comfortable, when they are criminalized, when it is illegal to have certain behaviors, they are not likely to come forward for treatment. They are not likely to come forward for testing. And we have to make sure that communities are partners. We have seen their massive input into the COVID response in terms of HIV, in terms of TB, and we must continue to work with them and fund them, because even communities need money for expenses, just like public sector programs do. We really have to revive and maintain essential HIV services during the pandemic. The pandemic is not over. The pandemic is with us and will remain with us for the foreseeable future. And this is going to require sufficient resources. While donor programming funding in our region is fairly limited, domestic funding will have to become a key input from all member states to ensure that people with HIV, their families, are not left behind. Thank you very much, and back to you, Chair.
Thank you, Dr. Mukta, for that snapshot of already flagging programmatic situation in countries and made worse by the pandemic of COVID this year. So before I proceed further, maybe I would like to check with the IT if RD's address can be put on now. Is it possible?
Good afternoon and a warm welcome to this World AIDS Day event. The year 2020 marks an important milestone in our quest to end the AIDS epidemic as a public health threat by 2030. First, it is the life cycle of the Fast Track 2020 targets. Second, it is the beginning of the decade of action towards achieving the Sustainable Development Goal targets. We have 10 years to transform our world and to deliver on the global goals. This year also saw the emergence and spread of COVID-19, which in addition to killing more than 1.3 million people so far, has caused substantial disruptions in essential health services, including for HIV. A recent WHO survey of 61 countries showed that 38 had experienced disruptions in HIV testing, 23 in HIV viral load testing, and 17 had experienced disruptions in key population-related services. A regional assessment showed that 4 of the region's 11 member states experienced similar challenges. Member states have nevertheless made tremendous efforts to revive and maintain essential health services, including for HIV as a core part of the COVID-19 response. On HIV specifically, They have dispensed antiretroviral drugs on a multi-month basis. They have provided take-home dosages of drugs for opioid substitution therapy, and they have worked with key populations to ensure that both demand and supply side barriers are overcome. They have engaged, supported, and protected frontline health workers, including nurses and midwives. This is in keeping with the steady progress member states have made against HIV in recent years, which has saved and improved the lives of hundreds of thousands of people. But despite that progress, both the region and the world will fail to meet the 90-90-90 fast-track targets. As the theme of this year's commemoration highlights, together we must act with global solidarity, resilient services to bend the curve and end the AIDS epidemic as a public health threat by 2030. 3 priorities must chart the path ahead. First, we must make every possible effort to empower communities to prevent HIV and to access services that detect and treat it. Information campaigns can ensure all key populations know how to reduce the risk of infection, for example, through safer sex or safe injection. They should know where and how to access these services and must feel comfortable in doing so. By empowering communities to prevent, detect, and treat HIV, countries can make full use of a range of new tools, such as pre-exposure prophylaxis and community-based and HIV self-testing, as well as better antiretroviral drugs, such as dolutegravir. Second, we must harness the rich experience of communities affected by HIV. Epidemics are dynamic and change over time. We must understand why new infections have plateaued and identify high-impact interventions that will bend the curve. Acting on the insights and advice of key populations is a precondition of success. Third, we must ensure that all initiatives are fully funded and synergized with the quest to achieve UHC, which the region has pursued as a flagship priority since 2014. We must not only strengthen health systems to provide services that are of good quality and accessible to all, but we must also build health systems for health that promotes community engagement and buy-in. To end this epidemic, we must leave no one behind. I look forward to the insights you will share on our years-long struggle against HIV and to hearing of your experiences in supporting affected communities and services throughout this pandemic. I wish you an inspiring and engaging World AIDS Day and reiterate WHO's steadfast commitment to end AIDS as a public health threat for the health and well-being of all. Thank you.
Excellencies, distinguished delegates, ladies and gentlemen. So that was the RD's opening address, where she highlighted the current situation, the challenges that we face, and some of the steps that we need to take as we move forward. Now, I have the pleasure to invite Dr. Shannon Hader, Deputy Executive Director, UNAIDS, to deliver her address on Towards 2025 Targets, Sustaining and Strengthening the Public Health Response to HIV in Southeast Asia in Times of COVID-19 and Beyond. Dr. Hader, please.
Great, thank you so much. And it really is a privilege to be here together with all of you today. Thank you, Your Excellencies. Thank you, colleagues, friends, and to the organizers for inviting us to participate. I must say this World AIDS Day feels very different. It's a day reserved for remembering those we have lost to HIV and AIDS and for the recommitment to defeat this terrible pandemic, but it's shadowed by a new pandemic that has changed our day-to-day lives. But as we endure the challenges of current uncertainties, lockdowns, distancing, health systems strained like never before, we can't lose sight of our goal to end AIDS. The unfortunate truth that we've heard from the first two speakers is that the Asia-Pacific region won't meet its 2020 targets. In addition to the failure to achieve the 90-90-90 targets that you've heard so far, I must also mention that our key population prevention coverage targets have stagnated around the region at only about 50% reach, and much of these programs funded by external donors rather than governments themselves. COVID-19 has certainly imposed additional challenges. Insufficient investments and actions on HIV and other long-running pandemics have left the world exposed to this new global health threat. But on this day, there is reason to hope. Challenges in service delivery caused by COVID-19 have accelerated innovations and partnerships in service delivery in some places. The COVID-19 epidemic has shown where quick adoption of pending policy decisions and changes to delivery mechanisms all over the world and Southeast Asia as well have taken hold. We've seen accelerated introduction of differentiated service delivery approaches like multi-month dispensing of antiretroviral treatment drugs, letting patients have 3 months or 6 months of their necessary medications rather than mandating they come back to facilities over and over again. We've seen take-home doses of opioid substitution therapy up to 2 weeks in Myanmar, things that were previously so restricted that clients needed to go to a facility every day. We've seen expansion of home deliveries of medications, and we've seen community initiation of pre-exposure prophylaxis in Thailand and Myanmar. And these changes need to be sustained, expanded, and institutionalized in post-COVID-19 times. But not all parts of the HIV response have seen the same agility and innovation under COVID-19. Globally, HIV prevention services, especially those for key populations, have been set back further under COVID-19. But where we have seen inklings of successes during these times is where community-led organizations who are key providers for key population prevention services have been recognized as essential providers and funded to do and to continue their work. Where we've seen successes are where governments have social contracting in place to support these community-led organizations, passing domestic funding directly to these community-led organizations themselves, recognizing their core role as part of the modern system for health. And India is a shining example of such social contracting. And importantly, communities of key populations and people living with HIV are also recognizing and addressing that while HIV and COVID are health issues, they're about more than just health alone. In India, in Bangladesh, in Thailand, communities have stepped up to advocate for and deliver livelihood support to key populations during this time. The resilience of the HIV response during the COVID-19 crisis gives UNAIDS confidence that we can not only adapt and recover, but that we can also surge forward, make up for lost ground, and reach global goal of ending AIDS epidemic by 2030. So on this day, we're also looking to the future. UNAIDS has worked with partners for the last several years to develop a set of proposed targets for 2025 that can help guide us to that 2030 goal. These targets take a more holistic, nuanced approach than the 2020 targets that they replace. These targets place people living with HIV and communities at risk at the center of the response. They show how different subpopulations, different geographic areas, different epidemic situations require different packages of services, because we now know that having a national average or a global average of service coverage won't get us to controlling the epidemic. If locally those most affected are consistently missed, then the virus will win. The new targets build on progress towards 90-90-90 by calling for 95% coverage of a core set of evidence-based HIV services, including 95-95-95 for testing, treatment, and viral suppression, as well as 95% for prevention, combination prevention services, sexual and reproductive health services for people living with HIV and people at risk for HIV, and 95% coverage of services needed to eliminate vertical transmission. They also emphasize the importance of removing social and legal barriers to accessing services. We cannot reach 95% coverage of services if we do not squarely address HIV-related stigma and discrimination and gender inequality, if we don't get rid of laws that criminalize populations at highest risk for HIV infection. And these targets also emphasize the importance of integrating the HIV response with efforts to achieve universal health coverage and the SDGs. So we definitely need this region to help lead the way forward to achieve these 2025 and 2030 SDG targets by promoting, expanding some of the best practices from this region under COVID-19 as models for the next phase of the HIV response, to adopt innovations for services more quickly and to accelerate progress, to place civil society and communities at the center of the HIV response through social contracting, to integrate innovations in the HIV response with health services in the context of UHC, with special attention to key population prevention services and virtual space interventions to reach young key population members that are increasingly being missed by traditional conventional programs and delivery methods. And finally, we really need to bring back the early political commitment displayed by this region 20 years ago, which rapidly reversed the early epidemic. But we find that we had a lot of unfinished business. The epidemic is not over yet, hence the need now to reinvigorate that spirit, to take action that will address structural and rights barriers to services, to increase domestic budget support to fund key population prevention programs, to build solidarity among government, civil society, private sector, and other partners. You know, challenges like HIV and COVID-19 can only be defeated when we work together and ensure that no one is left behind. So now is not the time to give up or to expect less. Now is the time to show just how much we can do together. So thank you.
Thank you, Dr. Haider, for your very thoughtful comments and bringing us back to the realities and the difficulties that we face, yet that there is a way that we could address many of these issues. Thank you. We now go to Professor Adiba Kamrul Zaman, President, International AIDS Society, to give us a talk on the global health crossroads, lessons from the pandemics of HIV and SARS-CoV-2. Professor Adiba.
Good afternoon, everyone, and greetings from Kuala Lumpur, Malaysia. Thank you very much for inviting me to be a part of this high-level meeting. The COVID-19 pandemic has exerted a massive health and economic toll across the world that has forced us to re-examine existing global health investments and policies. Travel limitations, closure of businesses, and lockdowns in an effort to contain COVID-19 have created massive disruptions, including to the delivery of other health services. A recent survey in 106 countries found that COVID disruptions have affected 85% of HIV programs, resulting in increases in the numbers of missed visits, decreases in the number of ART dispensations, and decreases in the number of HIV testing and virally suppressed. Disruption in PrEP services have been noted in both low and high income countries. In addition to rolling back gains made in the last 2 decades with HIV control, the COVID-19 pandemic also threatens to undo advances made in malaria control. A significant reduction in the notification rate in malaria diagnoses has been observed in some settings as a result of fear of attending a healthcare facility or diversion of healthcare staff and resources from malaria programs to the COVID response. Similarly, a reduction in TB disease notification has been noted in Asia, Africa, and the United States. Disruptions in TB services could have a significant impact on the goal to end the global TB epidemic by 2035. Equally significant has been the impact on non-communicable diseases, as prevention and treatment services for diabetes, heart disease, cancer, and other diseases have, of course, been similarly disrupted. In a survey, for example, of 356 cancer centers from 54 countries across 66 continents, 88% reported facing challenges in delivering care during the pandemic. Common reasons included an overwhelmed system, lack of personal protective equipment, staff shortages, and restricted access to medications. Missing at least one cycle of therapy for more than 10% of patients was reported in 46% of the centers. As we gain control of the SARS-CoV-2 pandemic, or COVID-19 pandemic, in the coming months ahead, through a combination of public health interventions, more effective treatment, and eventually vaccination, the devastation that the pandemic has had to healthcare and the world's economy will necessitate a rethinking of how we deliver healthcare. Key to the rapid achievements seen in COVID-19 science, diagnostics, treatment, and vaccine has been the global scientific collaboration that must be the new norm in global scientific research. A second paramount initiative will be the need for health system strengthening, as has been mentioned by other speakers, moving away from disease-specific siloed programs to integrated health systems that can address a multiplicity of health issues, as well as support integrated surveillance and data systems and supply chain management and delivery. The COVID-19 pandemic has also forced the acceleration to telemedicine and other health technology that should continue to be expanded. Both the HIV and the COVID-19 pandemics have highlighted the risk posed by health inequities. It is becoming increasingly clear that some populations, such as racial and ethnic minority groups, migrants, and prisoners, are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and health care access, affecting those groups are interrelated and influence a wide range of health and quality of life outcomes and risks. Community engagement, community empowerment, and community-led services have been the hallmark of the HIV response. Examples abound from around the world where communities have gone the extra mile to ensure HIV services are not disrupted in this COVID environment. Home deliveries of ARV treatment and clean needles and syringe are just some examples. Likewise, to be successful in the response to COVID-19, communities must be fully engaged and be a part of the solution. In addition to integrating health systems redesign and strengthening in the post-COVID world must therefore also include community system strengthening with adequate funding and an investment in training, infrastructure development, technology, and digital access. On behalf of the International AIDS Society, I call upon my Asian colleagues and the global community to address the challenges upon us head-on. Innovation must include equity, science must inform policy, and communities must be meaningfully engaged every step of the way. Thank you very much.
Thank you, Professor Adiba, for that excellent talk. I think you have highlighted, and I think the COVID pandemic had clearly shown that our practice of running vertical programs does not provide us what we need when we have such a dramatic situation as the pandemic of COVID. So thank you very much once again, Professor. Let us now move to the next talk, which will be given by Mr. Midnight Punka Set Watana, Executive Director, APCOM, who will address as representative of the community. Mr. Punka Set Watana, please.
Thank Thank you. Good afternoon, Excellencies. Sawadee krab from Bangkok. Thank you, SEARO, for this opportunity. Happy World AIDS Day 2020, Global Solidarity, Shared Responsibility. My name is Midnight. I'm the Executive Director of APCOM, and I shall be giving you some quick thoughts on COVID-19 and beyond and communities as the core of resilient health systems. Next slide, please. So this is an overview of what we do in the region. Just to kind of just give you a background in terms of the over 30 countries that we are working in and across 200 organizations that we are operating in. Our work centers around education, innovation, research, and advocacy, and the important bits that the previous speakers have mentioned around the community empowerment and engagement. So we want to ensure that by 2030, everybody, including people of diverse sexual orientation, gender identity, expression, sex characteristics in Asia Pacific can achieve sustainable development in all aspects of their health, rights, and well-being. Next slide, please. In terms of the community engagement during COVID-19, APCOM started sharing the policy protocols to our community groups. That includes both office policy, that was going through regular reviews before the lockdowns and after lockdowns, and also for countries and communities that are also attending events and meetings, and that policy you can see there. For our coordination, that we did reach out online through like this Zoom calls, looking at what are the changing needs of the communities as it changes, and what would be the immediate support and the gaps. And with those stories that we received with the support of UNAIDS, when we started the newsletter, giving the communities the space to write down what are their thoughts, what are the issues really on the ground since April. So we're now in our 16th edition with over 40 stories from the communities across Asia Pacific region. And from those stories, we were able to then put the letter through to WHO DG to ensure that LGBTI voices and key populations are not being left behind during the COVID-19 pandemics, and that their needs, particularly their rights, are being adhered. So we did receive a very good response from WHO Director General. So we're very grateful for their leadership at the global level. We also started doing research. And just last week, we had the APCOM Community Summit, the largest of its kind, where the community has come together to discuss issues at the regional level around what are the needs for us to move forward together with other sectors. Next slide, please. The main issue, as many have already spoken about, is the flexible funding for emergencies. So we found out that even within the programs, there is a lot of inflexibilities to amend budget lines to then go through the needs of the communities, particularly around food, purchases of PPE, sanitizers, and face masks. And that emergency funding actually are not within our region, then they're mostly outside the Asia Pacific itself. So then we as organizations have to support other community groups to then apply for those emergency funding, which is not very much, but it does really help communities on the ground to be able to, as you can see, give food packages to their communities. APCOM staff also started their own put their salaries together to give emergency packages to the communities on the ground. We even did Facebook campaigns, and then supporting the communities to do the research to then do advocacy around the needs for flexible emergency funding. Next slide, please. What we have been able to do online, particularly around ensuring that the prevention messages goes to the younger populations, and also ensuring that there is generating information consistently throughout the COVID pandemic, is through this collaboration with the linkages, and also in partnership with Durex and Andrew Christian, to give the condoms and lubricants through online service delivery, and then also then promoting testing services as well. So as you can see here, we've since April, we've delivered 10,000 condoms and lubricants, and that through the different reservations and uptake of services through Facebook, Google, Hornet, and through our website. People do actually want to access services if that is available and it's easier for them to access. Next slide, please. We've been able to gather the communities together online and to talk about their issues to other stakeholders. So we did virtual powwow with HIV and LGBT organizations in Thailand in May, and then we're continuing that coordination until now to ensure that there is synergies between the communities working across different sectors, and that their stories are also being heard through other stakeholders. APCOM has also been involved with the ASHM COVID-19 task force to ensure that we then make the platform for other communities, so sex workers from APNSW and also transgender people from APTN, to be able to have that platform to then raise their issues and also what their communities have been able to do during COVID-19. Next slide, please. As others have also already mentioned about service delivery through communities. So it's just an examples of PrEP being able to be delivered in northern Thailand through different use of protocols within the clinics to ensure that both the clients and the staff are able to access these services safely. And that organizations such as the Post Home that does work with people living with HIV can do home delivery services and ART delivery through courier services. Swing, a sex worker organization, were able to kind of mobilize communities to give food packages and also to highlight the fact that because sex workers are not recognized, they also fall through the social safety nets of government. Next slide, please. Research is really important, so we are collecting information from the communities in Thailand with over 1,000 respondents already to then give guidelines and recommendations for future emergency crisis. So this is going to be community-led data gathering to look at continuation of improvements of services in different countries in the region as well. So with good practices that we are looking to collect and with our newsletters that we've got the information from to then package that in a way that it goes to policymakers such as yourselves and people that needs to know then what could be the good learnings from the community that could be scaled and that other countries could also learn from. Next slide, please. So just an example of findings through working with AFAO and also with the Global Fund, the last mile first, safeguarding communities during HIV and COVID-19. A lot of these are previous panelists have already spoken about, so I won't go into it, but it's really emphasizing that the communities are really at the front of those emergencies. So it's not just about HIV, sexual health services, reproductive health services, it's also other emergencies that is reaching other vulnerable groups, those marginalized as well. Next slide. So this is my last slide in terms of some recommendations for the support to communities, particularly around mechanism for granting that they could use for emergencies. We need to have that for communities to access quickly and respond quickly to the ground. Supporting community-led interventions to innovate their service delivery and linkages and increase the reach, particularly for online interventions. Supporting community to generate data and good quality data and profile and highlight the voices of the communities on the ground. Removing policy barriers to community-led systems for health. So we're looking at how to ensure that HIV self-testing could be scaled up, pre-exposure prophylaxis could be given to people, and looking at multi-month ARV dispensing. And then lastly, supporting the resiliency and sustainability of community organizations. So this is the institutional development. There's so much that we have gained so far, and with COVID-19, and then with this being with us for some time, we need to ensure that we don't lose the communities that are already reaching the most vulnerable, and how to ensure that this will continue and that they'll also be in the center of the response. Thank you so much.
Thank you, Mr. Midnight, for that excellent talk and the great work that APCOM is doing in these special groups around the world. Your Excellencies, ladies and gentlemen, I'm going to make a small change. I understand that His Excellency, the Minister of Indonesia, needs to leave for something urgent. Therefore, I'm going to switch the order of the speakers a little bit. And I have now the pleasure to invite His Excellency, Lieutenant General Dr. Tirawan Agus Putranto, Minister of Health, Indonesia, to please address us. I think there's something wrong with... Okay.
Executive Director of Global Fund, distinguished delegate, ladies and gentlemen. Good morning, afternoon, and evening. It is a great pleasure for me to participate in this high-level leadership meeting to commemorate this year World AIDS Day. The commemoration of this day is a momentum to strengthen and consolidate our effort made by all countries in the world to fight the HIV/AIDS pandemic for more than 4 decades ago. Therefore, I highly appreciated the WHO-SEARO regional office effort in organizing today's meeting. Excellencies, ladies and gentlemen, as we may already know, the global community agreed to achieve the 90-90-90 targets by 2020. We agree to ensure 90% of all people living with HIV know their status, 90% of whom will be on antiretroviral therapy, ART, and 90% of whom will achieve sustained virologic suppression. Reaching the triple 90 target will allow us to end the HIV/AIDS epidemic by 2030. Excellency, ladies and gentlemen, Indonesia has set up a program called STOP, which stands for Suluk or educated, temukan or find, obati or treat, and pertahankan or maintain ARV treatment. This program aims to accelerate the achievement of the 90-90-90 target, which, as you can see in this slide, we still need a concerted effort to achieve the target. Currently, there are around 354,000 diagnosed PL/HIV, with 73% of them have been treated with ERT. Among 25,745 lost to follow-up case in 2018 till 2020, 82% has been traced, with 13% has been readmitted to RRV treatment. However, currently there are only 26% of the diagnosed PL/HIV that are still on ERT due to 40% lost to follow-up. We realize that we need stronger leadership, commitment, collective effort, and greater resources to fight HIV/AIDS in the next 10 years. Now that we are facing the COVID-19 pandemic, our burden in increasing to maintain HIV-related health services. We are aware that we cannot rely on the already decreasing global HIV/AIDS funding. Therefore, we are continuously increasing and strengthening our national health system, including the health financing scheme and the national health service system. The development and issue of the minimum standard of service system have been gradually improving the increased testing and treatment coverage for the key affected population and other vulnerable groups such as pregnant women. The MSS system serves as a foundation for the subnational government to expand its facilities capacity to reach the 90-90-90 targets. Excellency, ladies and gentlemen, there is no doubt that COVID-19 presents a greater challenge in combating this forgotten epidemic from the optimum test and treat implementation, increase of loss to follow up PL-HIV, change of assignment of the health professional to other healthcare facilities, supply chain to the ongoing stigmatization toward the PL-HIV. Excellency, ladies and gentlemen, as you can see in the slide, among 30,058 health services facilities in country, approximately 9,807 or 75% of them have the capacity of HIV testing, but only 13% of these facilities are able to provide HIV test and treatment. This year, we have also making effort to increasing the community access to the HIV and ERT services in health center by adding 1,062 new facilities for testing and treatment. So, there are currently around 2,721 total facilities that able to do test and treat, comprising 21% of the total health facilities available across the country. Other efforts that we conducted include mentoring program for healthcare professional, partner notification, and early treatment. To address the ongoing stigmatization, we continue to engage and partner with local civil society organizations to eliminate stigmatization and discrimination toward PL-HIV. Excellency, ladies and gentlemen, during this pandemic situation, we view that the HIV/AIDS service need to be continued as one of the essential health services. Therefore, we have issued the protocol for implementing HIV/AIDS services during the COVID-19 pandemic. With this protocol, we aim to keep the HIV/AIDS services continue, while still upholding the COVID-19 health protocol. The graph on the right side shows that the implementation of the health protocol has been contributing to improving the HIV testing coverage, case detection, and HIV treatment coverage after the guideline is issued. Approach on the protocol include 1. The use of the standard precaution or health protocol. 2. Give priority to PL-WHO and injection drug user. 3. Ensure the availability of HIV and STI prevention tool in health facility. 4. Multi-month ERV dispensing. And 5. Maintain collaboration with local government, NGO, and GSU. In this slide, I wish to give some example of our effort during the pandemic. First, in an example of our approach to ensure the PL-WHO receive direct medication conducted through collaboration with online delivery service platform. And second, is an example of our approach to ensure the PL-WHO on ERV have a suppressed virus level that can reduce transmission conducted through activation of the lab network. Excellency, ladies and gentlemen, we believe that the following policy and strategies in HIV/AIDS prevention and control in 2021 till 2025 are still relevant and feasible to do with adjustment to the COVID-19 situation. One, strengthening of the commitment of the public and private sector. Two, improvement of community access to quality and comprehensive health services. Three, strengthening of evidence-based prevention and control. Four, strengthening and partnership and community participation. Five, development of program innovation. And six, strengthening of program management. On this World AIDS Day 2020, through global solidarity and shared responsibility, the government of Indonesia reaffirmed its commitment to maintain its HIV and STI services work as one of the essential health services during this COVID-19 pandemic. I thank you.
Thank you, Your Excellency, for that wonderful talk, and it's good to know that so much is being done in Indonesia. May I now request His Excellency Dr. Mintwe, the Union Minister for Health and Sports in Myanmar, to please kindly address.
Good afternoon, Dr. Pam Nemja, Director of Program Management, SEARO, and RD. Kindly convey my good wishes to RD, although she is not here, and also Dr. Mukta Sharma, Regional Advisor from SEARO, and Dr. Shannon Harder, Deputy Executive Director from UNAIDS, and Mr. Midnight, Executive Director, EPCON. I will remember your name forever, Mr. Midnight. And also to my colleague health ministers. First of all, I would like to congratulate Pam Nemja to hold that post DPM SEARO. I'm wishing that you will be very successful, having known you for decades. First of all, my short address will be geared towards the letter written to me by RD on 29th October, which is maintaining essential health services during COVID epidemic, sustaining and accelerating public health response to HIV and STI. Having had the spirit of solidarity is the key to success in fielding essential health services to HIV, STI. This is very much in line with the theme of this World AIDS Day, which is Global Solidarity, Shared Responsibility. The reason for maintaining essential services for HIV, AIDS, STI, and other diseases are that we need to maintain the gain that we already had in different areas. So in other words, I would like to emphasize, and also I'm emphasizing in my country that all essential health services, including HIV and STI, must be maintained throughout this COVID pandemic. This is very important. All programs must continue to the extent possible. In that context, we need to think holistically. So what are the essential health services for different health programs running in my country and in your country? That is very important. So we need to identify essential health services that we need to give for each and every program in the country, including HIV and STI. It should be prioritized. We have 10 essential, but we may not be able to carry out these 10 essential. So we need to prioritize, and we will do first 3 or first 2 or first 5, depending on the scenario. In order to prioritize, we have to use a certain set of criteria. Then we may be able to identify the exact number 1 priority activities. Even if we look at STI and HIV programs, there are many secondary activities or interventions, which are less important. So these activities may need to be trimmed out or weeded or postponed for the time being. That is very important. So what are the priority activities? Priority activities for HIV/AIDS as well as for STI are that those activities which can influence transmission and transmission pattern of HIV and AIDS must be there. And these activities must be cost effective, less labor intensive, and additional side benefit or wide-ranging benefit, plus less untoward implications and easy to implement. These type of activities or intervention must be identified by conducting a brainstorming session among the programs and the director generals or directors or regional or provincial directors concerned. This is a special situation. We cannot conduct all activities. So we need to develop a special type of Gantt chart to identify specific and fair division of labor as well. Who is going to do what? This is unusual situation. On top of that, this unusual situation is very important because the spread of COVID is very fast because of the respiratory route and also because of infectiousness, high infectivity rate of COVID-19. So this is a very, very special circumstance. If we have pandemic for other diseases, I don't mind, I don't care. But this is serious because of respiratory. That point must be maintained. And also, this is some sort of interim measures that we are going to do. So we need also to develop a monitoring checklist as to see all those essential activities that you are doing for HIV and STI are okay or not okay, using monitoring checklist type of thing. If possible, as mentioned by Mr. Midnight, Executive Director EPCON, we may need to conduct implementation research or operational research to see the activities that we are going are okay or not okay. Because we may not be able to feel all the activity A to Z or A to M. Maybe we'll do A to A, B, C. But in that context, is it okay or not okay? This is very important. And also we have to work in a very constrained atmosphere because of COVID-19. These are the points. So how to deliver essential health activities for HIV/AIDS during COVID pandemic times? Benefits of doing the points alluded to earlier is we can use less amount of money, especially some budget may be saved because of that, which can be used for post-COVID activities. That is very important. Although we may have $10 million, we may need to use only $5 million or $4 million because we are not going to conduct all activities in one go. So certain amount of money will be spent. For HIV/AIDS, as all of you sitting here are well known, there is a special risk group, like prisoners, MSN, commercial sex, etc., etc. So these must be the targeted group. All we know, we will do this. But even in the targeted group also, we may need to prioritize if necessary. That is very important. We may not be able to act on all the targeted groups, certain targeted groups. Even in targeted groups, which part of the country, which age segment, that need to be considered. We will not spread out the whole intervention equally. That is very, very important. So we have to be very careful. This is very, we have to very seriously think of how to do it, brainstorming. That is very important. Likewise, for other diseases, we have to see along that same line of thinking. We cannot do all. So what are we going to do? And also, especially for HIV and STI, and also for certain diseases, we need to emphasize on health literacy promotion, which is not costly. We can do health literacy promotion through internet, through Facebook, or using, handheld speaker thing. These are activities very effective, which can have sustained and long-term impact for HIV and STI program. That is very important. Now, this health literacy promotion program should be part and parcel of these essential health service activity because it is very cost effective, as I mentioned. Long-term beneficial effect, multiple side benefits are there. So that is very important. I would also like to mention, public health response to HIV and STI will be among the services rendered to the population at large, together with all the primary healthcare activities and related and relevant activities of HIV and STI to that of other programs like MCH, child health program. These must be integrated and combined to the extent possible. In other words, to fill HIV and STI activities, not only program managers of HIV and STD, but all relevant program managers must be involved, like hepatitis, MCH program, health literacy program manager. This is very important. So we have to think very seriously. We have to do that way. Otherwise, the COVID, already almost 11 months already. We are suffering. This is very, very important. However, what in my mind is most important activities program which should not be left behind is EBI, NCD, TB, and MCH program. These programs should be at the forefront, and we should maintain and carry out the prioritized activities of these programs. We cannot leave the EBI program idle. Very, very important. In my country, 13 diseases will be prevented if we have this EPI program going on as usual. That is very important. Now, this solidarity, the theme of this World AIDS Day this year is solidarity. It is very important at the global level. Global level, solidarity among UN organization and government. But what is more important is the solidarity at the country level, regional level, provincial level, township level. That we need to get it through various means. To achieve solidarity in my country may be totally different in Thailand or Indonesia or India. That we have to work out by ourselves. That is very, very important. Now, solidarity in terms of program must be considered. Solidarity in terms of HRH issues must be there. So even solidarity among budget allocation must be there. So this year World AIDS Day theme is very relevant, not only for HIV, STI, but also for all programs across the activities of the Ministry of Health and Sport. So in other words, this title of this virtual meeting, this sustaining and maintaining essential health services is very important. It served me as a wake-up call as to what the health minister should think. Very, very important. For that matter, I would like to thank the UNAIDS as well as the WHO and all relevant organizations, the WHO headquarters, etc. That is very, very important. Here, I would like to take the opportunity of thanking the Global Fund for giving funding support as well as many other support together with WHO and UNAIDS that they are giving technical support. I appreciate very, very much. Now, for this to happen, program managers of HIV, for this to happen means for this essential services to be maintained, program managers of HIV/AIDS program must set clear-cut guidelines to the basic health service staff working at the ground level, what they have to do. That is very important. And we need to emphasize that we are not going to feed all activities. We will be feeding a selected number of activities, and please do it right, or please do it serious. That is very important. Most important is that program managers of HIV and STI should think, what are the essential services for HIV? What are the essential services for STI? For different target groups, in different groups of population, different segment of population. How to do it, what to do it, when to do it, how to monitor it, how to evaluate it. These must be set out in very clear-cut bullet point type of memos or something like that, and should be sent out to all the staff working at the ground level. So with that, I would like to conclude by saying that to the extent possible, we will leave no one behind in the context of achieving UAC in my country. Thank you very much. Thank you very much.
Thank you, Your Excellency. With your long experience and expertise in public health, you always come down with very pertinent and practical suggestions, and thank you very much for that. Now, we shall go back to the keynote address, and I have the pleasure to announce that His Excellency Dr. Vardhan, Union Minister of Health and Family Welfare, Government of India, who is also the chair of our WHO's Executive Board, who will deliver the keynote address via a pre-recorded video.
Dr. Poonam Khetrapal Singh, Regional Director, WHO-SEARO, Excellency Ministers, Ambassadors, Executive Director of UNAIDS, distinguished delegates, ladies and gentlemen, Namaste. At the outset, I would like to take a moment to acknowledge community members, people living with HIV. I would also like to commend all the frontline health staff and community health workers who are working tirelessly and boldly to address COVID-19 and ensuring continuity of essential health services in HIV. This World AIDS Day has significance for two reasons. First, we are all fighting a silent war to overcome the challenges posed by the COVID-19 pandemic. We have acted swiftly and introduced several measures in response to the pandemic. Ensuring continuity of other essential health services is a cornerstone of this response. The Government of India has prioritized service continuity, issued a series of advisories to ensure minimal or no disruption of essential health services, including for HIV. Yet, it is important to understand that the pandemic is far from over. Hence, the theme chosen by WHO for this World AIDS Day, Global Solidarity, Resilient Services, has even more relevance this year. As we say in India, Vasudhaiv Kudumbakam, the concept which exalts the entire world as one family. Such a global challenge indeed requires a response founded in solidarity. COVID-19 is not the past, it is the present, and we must be resilient and determined in making sure that no one is left behind as we fight to control the pandemic and protect lives. Second, as part of the political declaration on HIV and AIDS by member states at the UN General Assembly in June 2016, the world committed to the 2020 fast track targets. The Global Health Sector Strategy for HIV was adopted by member states at the 69th session of the World Health Assembly, spanning a duration of 2016 to 2021. It is time to take stock of where we are in 2020. I understand that UNAIDS and WHO will be reporting back on behalf of the member states on achievements to date and what we are not able to achieve. We are at the cusp of defining our course of action for a post-2020 agenda for HIV, and we must learn from our challenges and seek out new opportunities. Ladies and gentlemen, let me share with you some information on the situation in India. The AIDS response in India has been guided by evidence-based strategic plans ever since the inception of the National AIDS Control Program. The National Strategic Plan 2017 to 2024 maintains the focus on achieving the 95-95-95 targets by 2030. The program has continuously updated the operational guidelines and service delivery according to evolving evidence. With the fourth phase of the NACP in progress, the impact of India's AIDS response has been clear. By 2019, the estimated new HIV infections in the country have declined by 37% since 2010 and by 86% since reaching the peak of the epidemic in 1997. India's prevention program and the rapid scale-up of treatment services, including Treat All approach, have been global good practices. India has world's second largest antiretroviral treatment program with 1.3 million people on free ART. Building on to the success of India's HIV prevention model and treatment scale-up, and being cognizant of the fact that complacency could lead to setbacks, NACO has been reviewing and rolling out areas of innovations and programmatic acceleration. Innovations are required to address the changing dynamics of the epidemic as well as socio-cultural and other transitions. India has already piloted pre-exposure prophylaxis using ARV drugs as an additional prevention tool for key populations who are at higher risk. The operational aspects of how to integrate this into the program is being reviewed. The rapid scale-up of internet bandwidth and mobile phones offer tremendous opportunities. The program has already started efforts to define a methodology to estimate the number of people among key populations who can be reached in the virtual world. COVID-19 has taught us important lessons on how to work and influence virtually, and we must apply that for making our programs more successful. This will help key populations who are otherwise considered hard to reach to access information about prevention in general and information about services. The program is now reviewing local evidence and other factors to include HIV self-testing as one of the different approaches in HIV testing services. The program has already adopted community-based testing services to complement the extensive network of facility-based testing services. NACO is strengthening its strategic information infrastructure and reporting systems. Initiatives such as SOCH will not only provide people-centric, IT-enabled, and integrated information systems with embedded supply chain functions, but also ensure that real-time data is made available at all levels to better monitor and improve the program further. Finally, COVID-19 has taught us several lessons in terms of ensuring continuity of services. The use of telemedicine services, multi-month dispensing of ARV drugs to people living with HIV, take-home doses of drugs for people who inject drugs, who are stable on opioid substitution therapy, and community-based and other differentiated service delivery mechanisms are some of the prominent examples. Based on the specific state-level context, some of these measures could continue in a post-pandemic world as well. I am confident that innovations such as the ones mentioned here will help us further in ensuring resilient services for HIV. The importance of putting people at the center of all these cannot be forgotten at any stage. Government of India has an overarching motto of Sabka Saath, Sabka Vikas, which promotes inclusiveness and equity principles in all aspects of development, including health. People directly affected by HIV, including key populations, must always be at the forefront. Sustaining, innovating, and accelerating our efforts along these lines will further enhance India's and other countries' course towards the new 2025 targets that will succeed the 2020 targets. Working in global solidarity, I am sure we can collectively achieve the target of ending the AIDS epidemic as a public health threat for all people by 2030. Thank you.
On behalf of the Regional Director, Dr. Poonam Singh, and on my own behalf, I would like to convey our gratitude and appreciation to His Excellency Dr. Vardhan for taking time to deliver this keynote address, which was truly inspiring and heartening to know that so much is being done in such a large country as India. Thank you once again. Now, we'll go I understand that we also have a pre-recorded video message from His Excellency Dr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health from Thailand. So, yes.
Excellency Health Ministers, distinguished guests, ladies and gentlemen, and my dear Dr. Poonam, the Regional Director. It is a privilege for me to join the high-level leadership meeting on World AIDS Day 2020. During the COVID-19 pandemic, Thailand put our best effort to ensure that we can prevent the spread of COVID-19 and that our patients have access to non-COVID essential services. Even Thailand applied tight lockdown between April and May. ART increased among people living with HIV, who know their status from 85% in 2019 to 88% in 2020. In the midst of every crisis, it lies opportunity. Thailand launched guidelines in dispensing ART for 3 to 6 months since 2017. The progress of this multi-month dispensing was initially slow, but the COVID-19 pandemic has accelerated the implementation. The Ministry of Public Health, in collaboration with many partners, including the Thai Network of People Living with HIV, enhanced multi-month dispensing implementation nationwide since the beginning of the COVID-19 pandemic. In addition, Thailand has strong HIV community-based organizations. They are at the forefront of the COVID-19 response by working side by side with health workers. They reach out to the most marginalized and hard-to-reach populations to ensure people access to both HIV and COVID-19 services. These collective efforts benefit over 100,000 patients. Ladies and gentlemen, Thailand has committed to ambitious 90-90-90 targets by 2020. We have achieved the first and third targets with nearly 100%, while the second 90 is almost there at 88%. We commit to reach 90% of people with HIV receiving ART very soon. Thailand is the first country in Asia that has launched pre-exposure prophylaxis as part of combination HIV prevention under the Universal Health Coverage Scheme. Thailand has initiated over-the-counter sales for HIV self-testing and has successfully implemented key population-led health services model. In order to tackle the challenges on stigmatization and discrimination, Thailand supports community-led responses towards a stigma-free society. Ladies and gentlemen, while Thailand combats COVID-19, we do not compromise our efforts to respond to HIV. Despite the long and winding road ahead, Thailand continues our commitment to ending AIDS by 2030. We would like to call for global solidarity and shared responsibility to making the world a healthier place. Thank you.
Again, on behalf of the Regional Director, Dr. Poonam Singh, and on my own behalf, I would like to convey our gratitude to His Excellency Mr. Anutin Charnvirakul, the Deputy Prime Minister and Minister for Public Health Thailand, for that excellent address. Thailand, of course, has always been the leader and a model worldwide when it comes to HIV control, prevention, and related activities. So thank you once again. Finally, we have Dr. Jogeshwar Gautam, Chief Health Coordination Division, Ministry of Health and Population, Nepal, who is sitting on behalf of His Excellency Mr. Bhanu Bhakta Dakal, Minister of Health and Population. Dr. Gautam, please.
Director of Southeast Asia region, distinguished delegates, ladies and gentlemen. I'd like to thank the Secretariat for coordinating this high-level leadership meeting on World AIDS Day 2020. And I have the privilege to participate in this important meeting on behalf of the Honorable Minister of Health and Population, Nepal. The Honorable Minister sends his warm greetings to this august gathering, and I would like to give the message from the Honorable Minister. I quote, "I would like to take this opportunity to thank the organizers for organizing this important high-level meeting and congratulate all the member states for your understanding and continued work towards ending the HIV epidemic despite this unprecedented time of COVID-19 pandemic. As we all know, while great progress is being made in combating HIV/AIDS in many countries, we are far from achieving the 90 targets by 2020, including my own country, Nepal. and COVID-19 pandemic is posing the clear threat to much needed HIV service deliveries in the country. In Nepal, the HIV prevalence among the adult population is 0.13%, which is lowest since the start of HIV epidemic. The epidemic is concentrated in key populations like in many Southeast Asia region countries, and we have maintained low prevalence with introduction of targeted intervention for the key populations, expanded coverage of and access for the testing, prevention, and treatment. Despite COVID-19 pandemic, we have recently transitioned to the dolutegravir DTG-based regimen and rolled out throughout the country. Have rolled out self-testing, community-led testing, and other innovative interventions to increase the coverage of comprehensive HIV services. In Nepal, the HIV response is also one of the best examples of how the national program partners, donors, civil societies, and communities work together to achieve better results and make measurable impact. Despite these efforts, only 78% of the estimated people living with HIV are aware of the HIV positive status. Only 80% of them are on ARV treatment, and only 66% have achieved the viral load suppression. We still face challenges with elimination of mother-to-child transmission of HIV. The prevalence of sexually transmitted infection and syphilis is increasing in some key risk groups, and COVID-19 pandemic has not made these challenges easier. As a result of the pandemic and consequences of lockdowns and restrictions, HIV services deliveries have been impacted with varying degree. Nevertheless, under the leadership of the Director of the National Program and support from partners such as WHO and others, had come up with interim guidance on HIV service delivery early and during the pandemic and maintained HIV service delivery, particularly focused on key population. This has helped us ensure high reach of knowledge and practices with test and high proportion of people living with HIV are maintained on ARV. However, we have also seen challenges with reaching the migrants and prison inmates and decrease in early infant diagnosis during this pandemic. These challenges will further lead to setback on already trailing 90 targets. We also have greatest lessons learned during this pandemic and witnessed much resilience in service providers and modalities of service delivery, such as virtual capacity building, differentiated service delivery, effective multi-dispended home delivery of ARTs, take-home OSTs, and community engagement. We also witnessed excellent collaboration among governments and partners and unwavering support from all stakeholders. I believe that when we are faced with unprecedented challenges and time like this, solidarity, shared responsibility, and action based on science are the only solutions. I am glad that the theme of the World Aids Day 2020, Global Solidarity, Resilient Services, which clearly articulates that what we saw as drivers of positive action at the country level. Despite the challenges posed by the COVID-19 pandemic, the government of Nepal envisions ending the HIV/AIDS endemic by 2030 through meaningful engagement with the partners, donors, private sectors, and communities to support and strengthen the health service delivery. integrate HIV program within all universal health coverage with a patient-centered approach and develop and sustain resilient health services throughout the country. Nepal deeply appreciates the technical support we continue to receive from WHO and other partners and funding support from the Global Fund towards reaching the 2030 targets. We hope that all of us continue to learn from the other, invest and continue to work hard until we end this HIV epidemic. I on the behalf of the Honorable Minister of Health and Population and my own behalf, I wish you all a very successful deliberation for this important meeting. I thank you, Your Excellencies, ladies and gentlemen. Dhanyavad.
Thank you very much, Dr. Gautam. I, on behalf of the RD and on my behalf, would like to thank you for delivering His Excellency's wonderful address at this meeting. Please convey our appreciation and gratitude to His Honorable Minister. Now we come to the next part of the session for today, which is the panel discussion. I would like to very briefly introduce the panelists first. The panel will be moderated by Dr. JVR Prasada Rao, who was the former Health Secretary, Government of India, and also was the former Special Envoy to UN Secretary General for HIV and AIDS in the Asia Pacific. So he will be the moderator of this panel discussion. I would like to also briefly introduce the panelists. We have Ms. Aarti Ahuja, who is the Additional Secretary and Director General, National AIDS Control Program, Ministry of Health and Family Welfare of the Government of India. We have Mr. Eamon Murphy, Regional Director, UN AIDS, Asia and the Pacific. We have Professor Heidi Larson, Department of Infectious Diseases Epidemiology, London School of Health, Tropical Medicine, United Kingdom. Ms. Renuka Jadhav, Community Leader, Taras Coalition, India. We have Professor Salim S. Abdul Karim, Director, CAPRISA, and Professor of Global Health, Mailman School of Public Health, Columbia University, USA. And finally, we have Ms. Dr. Urban Weber, who is the head of High Impact Asia of the Global Fund. So we have a panel of distinguished panelists in this. And then now I would like to invite Dr. JVR Prasada Rao to please kindly take over and moderate the panel discussion. Thank you.
Thank you, Chair, and thank you for asking me to moderate this session. We're running short of time, I think by about half an hour or so we have to cut down on many of the formalities. But first of all, I would like to say about a good afternoon and welcome to all the distinguished panelists and other participants in this. Before going to the panel, there is another feature we have added this time, that is an audience poll. Can we have that slide on the screen, please? Where the people who are participating in this program also need to feel involved. So what we said was there is a site called www.slido.com. You can go to the site, enter the event code WAD, and respond to the question that is put here. And then you will get 1 minute time to give your question. And the question would be, what needs to be done differently to address gaps and accelerate efforts towards the 2030 goal? I repeat, what needs to be done differently to address gaps and accelerate efforts towards the 2030 goal? So you can put your answer. The time starts now. It will be just 1 minute of time you will get. It will be in 1 or 2 words, no sentences, please. Okay, I think we have done that. Now we go to the panel. I must thank the chair for already doing the introductions of the panelists, so I don't want to repeat that. There will be a slight rearrangement in the panel. Dr. Heidi Larson, one of the panelists, had to leave early for another meeting, so we'll change the order first a little bit. But first I will go to the first panelist, Ms. Aarti Ahuja, who is the Director General of NACO. Aarti Ahuja, you have taken over recently, a couple of months before, but you are not a newcomer to the AIDS program. You were in the Odisha AIDS Control Society as the project director in the 90s. So, what have you seen in the last 20 years in the AIDS program? What was there at the time, and how did it change now? How was the response, both in terms of the progress and also setbacks, especially with regard to the involvement of key populations? So if you can, in about three to 4 minutes, because the time is short, in about 3 to 4 minutes, if you can give quickly a few points on your perception. Thank you.
Thank you so much, sir. And I'd also like to thank WHO-SEARO for inviting me to be part of this panel. As you mentioned, I was at the state level. I was the PD NACO at the state level a long time back when the NACP2 was just coming in. That's the National AIDS Control Program, for those who are not aware. So that time all the planning was going on, and that is the time that the targeted interventions, the social contracting model came into being. And we were all working on that, and Mr. Prasada Rao was then in the position that I am holding today. He was a DG NACO at that time. So we also worked together during that period. But the specific thing you've asked is what has changed in the interregnum from when I was working as a newbie in the AIDS control program to now when I am DG NACO. What is it that has changed? And I would say a lot has changed during that period. First of all, at the societal level, there is a greater acceptance. Not only that, the law has recognized that, the society has recognized that, India has passed an HIV/AIDS Control Act. So there is a lot of legal backing to the work that we are doing. Secondly, it has over a period of time become an all of society approach. You find that the communities, the partners, the people who are stakeholders, everybody is now involved. There is, much more a coherent way of dialogue and discussion and incorporating those decisions. And I would say that over a period of time, there has also been more of, and which is obvious and which has happened in most programs, is that there has been a greater focus on evidence. Everything that is being done in the country today in the AIDS control program is on the basis of evidence. Not to say that it was not there earlier, but probably now the ability to gather evidence has also become sharper. It has increased. So we have more evidence, more granular evidence. Now we are going to have district level surveys, district level data coming in so that each district can prepare its own plan. So I would say the focus on evidence and the kind of evidence that's coming in has been the third change. And I'd also like to mention the fourth change, and that is the greater use of IT platforms, and especially during the COVID period. We had a teleconsultation facility, which is an app made by the government called eSanjeevani, which was used very extensively for teleconsultations. We have the iGot platform through which trainings were, online trainings, web link trainings were carried out for everybody across board, for people who work in the field and for the communities. Including, I would say, that in the times of COVID, we all know that communities lost, many of them had a setback in their livelihoods. So we had also mental health issues, and which were resolved through the helpline. So a lot of IT is now being used for this. I hope I have not taken too long. I have more to tell. Maybe if there's an opportunity later.
Thank you, Arti Ahuja. I think you kept yourself to the time. Now, Heidi, I hope you have time. You have to leave another 3 to 4 minutes. So if you can quickly have your intervention. I would like to ask you that you were in the research area, but your feet are firmly on the ground, and you have a lot of experience in this region also. What do you think should be the resilient systems for health, where people living with HIV and key populations are not left behind? What is the type of social contract you can have so that these people are not left behind?
Well, we've certainly, as we just also heard, come a long way. As for others, I worked very closely with Prasada on an initiative called AIDS 2031, where we were looking forward to anticipating what needed to get done to really bring levels down by 2031, which will be 50 years of age. And just to remind us that and next year is 2021, that'll be 40 years of AIDS. We have come so far. But living in the current COVID context, the importance, one thing that AIDS and COVID have in common on the topic of your question, Prasada, is this issue of not leaving anyone behind. COVID, like AIDS, in different ways, has exposed really the left out, the ones who are not getting the services that they need or want. It's exposed all kinds of weak spots in the system. COVID has done it in a more dramatic and shock way. When you think about just the past 8 months, if in AIDS, it was an unfolding, and the timeline, the evolution of how AIDS, HIV and AIDS unfolded is quite different than COVID. This is much more of a shock to the system. But I think some of the things that we've learned, and I think a number of the comments have been made about the importance of locality. And the best, I think, the best thing to make sure people are not left out is to be local, because it's much easier at a bird's eye view to miss local, to miss those left behind. The more you pull the lens back, the less you see the granularity. We have new opportunities now with, as we just heard, one of the aspects of an enabling environment is this incredible digital opportunities, technologies, geospatial mapping. We have so many new opportunities to be understanding where those left out communities and groups are. But the only way we're going to engage with them is local, local, local. And as Dr. Mind had said earlier, this is not just about global solidarity. It is crucial to have local solidarity. And the difference is not just between countries and what solidarity means versus even subnationally. The rights issues are also crucial. I mean, there's a fundamental rights issue of not leaving people behind. And we have, it's a different dynamic with the rights issues around COVID versus HIV. As you know well, I've been focusing a lot of my attention on getting community engagement around vaccines, which have been a very challenging environment. I mean, I remember in the beginning of AIDS, the protests were for scientific innovation. They were for ARV. They were for getting a vaccine. We still don't have a vaccine for HIV 40 years later. COVID in 8 months. COVID's been a scientific miracle in a sense, while AIDS has been a community miracle. We don't have that in COVID. Our big missing link in the COVID environment is the level of community engagement. And Mr. Midnight pointed to the virtual powwows, the listening, the dialogue. That's brilliant. I'll just end here, but I would say local, 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 using all the digital opportunities as well as the human opportunities and societal ones. Thank you so much. And I'm really sorry I have to leave because it's been a really great session.
Thank you. Thank you, Heidi. Thank you for staying on, and wish you good luck with your next session.
Yes.
Okay, we now move to Eamon Murphy, who is the Regional Director of UNAIDS Asia Pacific. Eamon Murphy, a staggering 98% of new infections in the Asia Pacific region are occurring among the key populations. This is unbelievable. This is a challenge and also an opportunity. How does UNAIDS perceive this challenge and what it intends to do to achieve the targets set for 2025, now that you have new targets, especially when most of the countries in the region are going to miss the 2020 targets? What are they going to do?
Thank you, Prasada. Very interesting discussion. I'm, of course, put on the spot, as Prasada used to be my regional director when I was a country director. But let me offer some very brief comments. A lot has already been addressed. For me, the issue of prioritization is critical. And this is the hardest challenge for any public health professional, is where to put the resources that are going to have the most impact. We have debates about this all the time. For me, the critical things, innovation has to be the mainstay of the way we move forward. Too many of the programs are relying on the old models of delivery. And this is one of the challenges. We have seen during COVID some innovation that's already started, but we know PrEP works, but still many countries in our region are trying to implement pilots when we don't need it. We've got Thailand, we've got Myanmar in this region, both implementing very effective programs. There are others across other parts of Asia and the Pacific. The virtual space, Mukta said it at the outset, this is one of the critical new areas of investment. Our programs need to continue working in the virtual space, just like we all are in the world of COVID. And this is critical because that's where the young are. And our second wave epidemics that are starting to be seen in countries, including Adiba mentioned this morning in a presentation we're both part of, in Malaysia and other countries in our region. This is critical for us to move to where the young are. The multi-month dispensing, the differentiated service delivery, the example of Myanmar with OST, take-home dosing. Now, these are things that are proven in other settings. Now we're seeing it in our own region. We've got to innovate and scale up is the other critical part of it. But the challenge then is resourcing, and that's universal health coverage. Most of our countries do not put prevention services in the universal health coverage essential services package, and that's a big mistake, and we need to move on that. So knowing that you've got a number of other panelists to talk to this, to me, that's the critical thing. We've got to take forward the innovation that started, but put it at scale and then resource it domestically, because the international resources are going to quickly continue either COVID impact or shifting to other issues. Thanks, Prasad.
Thank you. Thank you very much for being very precise on that. I now turn to Renuka Yadav, who is the member of the communities. Renuka, you are, I know you will be running short of time because you have come with slides, but you have to stick to the 3-minute slot and say what you would like to say very quickly. I would like to ask you that the COVID-19 has thrown a huge challenge where many members of the key populations, including sex workers, they suffered discontinuation of prevention and treatment services. From your experience, how do you perceive this challenge? And what do you suggest should be done to ensure uninterrupted service to sex workers and other key populations? Renuka.
Thank you, sir, for your question. During COVID period, there was big challenge for us, for community leaders, community members. But that 4-month period, sir, community members were in front line, and they were very much aware about their health issues. But still, there was coordination. They were connected with community-based organizations. We developed our networking. We took help from other stakeholders, and we focused on ERT to reach our members, sir. Of course, COVID-19 was big challenge for us, but we are facing it. We provided food to our community as a suggestion that government should be focused on community members' health. There should be strong mechanism, because migration is huge, sir. There, migration in community, there is migration is huge. So mechanism should be strong and effective.
Yeah, I agree. But what do you think? Do you think that the initial focused interventions on sex workers, etc., which are a very important part of the national program, do you think they are affected by COVID? Do you think they'll be again brought back into the system once the COVID is over? What do you think?
Definitely, they are affected, sir. But focus from health not diverted, sir.
Yes.
They were affected by their income sources. They were affected by their livelihood, but still they focus on their issues like ART medicine, using of condom. They were very much focused on these all things. Affected in the sense livelihood.
Yeah.
Yes, sir.
Okay, I think let's move now because we will listen to the other panelists also. Then maybe if you have time, we'll come back to you. Thank you very much, Renuka, for those interventions.
Thanks.
I would now turn to Dr. Salim Abdul Karim. Dr. Salim, you are an accomplished researcher yourself and act as an advisory capacity on strategic and technical matters on HIV. Based on your experience, what would you advise as one or maybe two innovations that could restore the priority on prevention and boost the prevention revolution in the Southeast Asian region? Dr. Karim.
Very good afternoon to you, Prasada, and very good afternoon to all of you attending this webinar. It's a great pleasure and honor to be with you here today. I think the question you've raised is one that we deal with at a very fundamental level, in that it's not a problem unique to what we're seeing in the Southeast Asian region, but one that we are grappling with globally. One of the key mistakes that we have seen around the world is to believe that we can deal with the HIV problem simply with a silver bullet solution. And this was promoted as an idea initially because people said, well, if you just treat everyone, you solve the problem. Well, now we've been treating large numbers of people, and the numbers and the progress we're making on treatment has been going reasonably well, but we are not seeing a change in the number of new infections. And so we're learning that prevention is much more than simply providing treatment. That while treatment is an essential component of it, it's not enough. And so we've got to go back to our HIV prevention toolbox, to look at all of the tools we have and to use data to identify in each situation what are the most appropriate tools that we can use. And we have many tools, whether it's education, whether it's condoms or STD treatment, or whether we're looking at the promotion of PrEP. So when we look at all of these tools that we have within the context of ensuring that we engage with communities, we facilitate the uptake of these tools, we can make a huge impact. So I will say in conclusion that we're learning that you can't solve every problem with a hammer, and you can't look at every problem as just a nail that needs to be hammered in. You have to understand its nuance. You have to pick the tools that are appropriate in each situation. And we are now learning the value of data to do that. And so when I look at the Southeast Asian region and I look at the key populations and I look at the level of engagement and the way in which they want to be involved, it gives me indeed a great heart to see the potential that you can have. So I wish you well in much of your work. Thank you very much, Prasad.
Thank you very much. I think excellently put. I now turn to our last panelist, Dr. Urban Weber. Dr. Weber, in most of the countries in this region, prevention, especially for key populations, got disproportionately less investment for the last few years. Now, as the head of the High Impact Asia and the Global Fund, what suggestions would you offer to have a sustainable investment landscape so that prevention is protected, especially prevention among key populations? Over to you.
Thank you very much, Dr. Rao, and it's a pleasure to be with all of you this afternoon. And if I look back into the current period of investment from the Global Fund, which is the period from 2017 to 2019 funding, which is used until the end of this year, and compare it with the 3 years that are ahead of us, then I must say that the situation in terms of funding actually has improved. So there is an increase of 15% from 640 odds to 730 odds $million from the Global Fund for HIV. So 15% in addition. But this is actually much less as an increase than the domestic funding has increased. So we can see over the course of the last decade or so a continuous improvement, both from international and from especially domestic funding. So here I'm speaking, of course, not about SEARO only, but about Asia and Pacific from the Global Fund's perspective in a total. So this needs to continue. But we have seen, of course, and other colleagues have talked about that already, a significant impact because of COVID. And we need to distinguish between impact of COVID itself and the secondary impacts that the lockdown situations had in many countries. So all of that has been addressed also by additional funding in the countries, but also by the Global Fund, where we made $150 million in addition available for the countries there. Now, when speaking about the sustainable investment landscape, then I think we need to appreciate what has been mentioned throughout this webinar, frequently and rightly so, that HIV in Asia is a concentrated epidemic and it is generalized nowhere in the region. But to address this concentration of cases and especially address the prevention needs, we need to have political will. We have seen that as a plea from Mukhtar earlier this morning, but also expressed by His Excellency, the Minister of Health from Myanmar, Min Titwe, where this political commitment actually is present. There are other examples in the region, but I would say altogether, we are not yet where we need to be in terms of expressing the political will to tackle these concentrated epidemics. So I think if we would get to a situation where we don't speak about 95% treatment coverage, but about 100%, everyone who needs treatment should be able to receive this treatment at either no cost or low cost, wherever this is possible. We need to have the recognition, the acceptance, and the appreciation that key and vulnerable populations have special needs and that these special needs must be addressed. And we need to have the commitment in the region for government and NGO cooperation, especially in the area of prevention. If we together commit to that, then I would say that the budgetary needs that are behind that are no longer the problem. I rather see the lack of political commitment or the insufficient political commitment for HIV prevention among key populations, key affected populations, vulnerable populations, as the main driver for the lagging behind in the response. It is, I would say, a question of political will first, and then the money will flow. Thank you.
Absolutely. You're spot on that. Absolutely. Thank you very much. And I thank all the panelists for sticking to the time. And but to be fair to the participants and the audience, we must at least take one question from them. So I'll just open the poll there. Can the IT team project the result? So one question, just for 2 minutes, to whichever panelist would like to take that. Yeah, so these are the ones. Now, in terms of the font, I think that's what ultimately decides which question got the maximum. I can see this MIPA is the one. Somebody has to explain to me what exactly the new abbreviations coming in. So this is the one. Can someone sort of expand it? What exactly is MIPA? So anyway, that is the question, which needs to be done differently to address gaps and accelerate efforts towards the 2030 goal. So any of the panelists who understand what MIPA is first, can take up this question and answer. Anyone would like to volunteer? Any of the panelists? Okay, otherwise we stop it here, and I would like to hand over to back to the chair to conduct the rest of the proceedings. Thank you very much.
Thank you. I would like to thank Dr. Prasada Rao for moderating this very interesting and useful session. I would also like to thank all the distinguished panelists for your thoughts and your guidance on these very important issues. So now let us go to the last item on today's agenda, which is the way forward. And we have Dr. Meg Doherty, who is the Director, Program for Global HIV, Hepatitis and STI Programs at WHO headquarters in Geneva. Dr. Meg, please.
Thank you, and good afternoon. And for us, it's mid-morning now, so I've been listening very with intrigue for your session. And at the outset, I would like to congratulate you all in SEARO for organizing this really very important high-level leadership meeting on maintaining the essential health services in the times of COVID and sustaining and invigorating the public health responses to HIV in the Southeast Asian region. This is so important on World AIDS Day. And I'd like to commend the commitment expressed by the ministers of health from, and you had India, Indonesia, Myanmar, Nepal, and Thailand all joining you. And that political commitment at the highest level, as we know, is one of our way forward because it's crucial to have member states fully engaged, addressing COVID-19, but also noting what we need to do to reinvigorate the public health responses for HIV. I also would like to express gratitude for the plenary speakers, the moderators, the panelists for their support on the program today and their dedication through their respective areas of work and all of the participants for their valuable suggestions. We understand the community was also quite active in this, and we want to ensure that their reaffirmed role and importance in this response during COVID is not forgotten. It is one of our main pieces around our World AIDS Day slogan, which is global solidarity and resilient services. And we know that the community-based services and community-led services have really been at the key to keeping HIV services moving during this time of COVID. We all know that COVID has had an impact on all of our essential health services. And what's so exciting is that you have shown that in your region, you've had some very strong responses where you've moved forward very quickly with differentiated service delivery, multi-month dispensing of ARVs, and also takeaway doses of OST and task shifting. I think the OST takeaway doses were so welcome, and we'd like to see that those in the future continue because these are part of maintaining and building back better and doing things that are working for person-centered communities now and then in the future. We've also seen that there's been lots of outreach to communities and you've overcome any kind of lockdowns and restrictions. And those kinds of interactions we'd like to see continuing in the future. We also know that the Southeast Asia region, just like globally, are lagging and starting to plateau in reaching their targets. And that all of us are off target for 2020, and we will have to do much better to be able to reach our 2030 targets. And the deliberations on the panel and all of your esteemed thought leaders brought out some of these key gaps and how we can mitigate these during the time of COVID. And it shows us what needs to be done and prioritized and financed. Certainly for your region, key populations are at the center. And it will be very important that you continue to put key populations at the center, as 98% of your new infections come from key populations or their partners. So we need to focus on the primary prevention, and some exciting news this today and as into the future is that we'll see the role of many different kinds of prevention tools, whether it's the depivirine ring, which has been pre-qualified by WHO in the last few days, or long-acting cabotegravir, which seems to work both in women and in men, and men who have sex and cisgender men. So we're really excited about all the options that we have for prevention, and those need to be pulled and brought out for PrEP in your region as well. We're also excited about some of the new information and price reduction for dolutegravir for children, and also dolutegravir price negotiations for upper middle income countries, which are several countries in the region that need to be able to access dolutegravir, but at a better price so that everyone has access. So these are the kinds of things we'd like to see in the future as you move forward. So before we close, we also know that people living with HIV, there's still unclarity whether HIV itself puts a person at risk of more severe COVID. So with that, as WHO investigates this and gathers more information around this, it's imperative that people who are living with HIV maintain themselves on therapy, on treatment. People who are tested should get onto treatment as soon as possible. A suppressed viral load and treatment for comorbidities will help keep somebody prepared and well should they become infected with COVID. So as we move forward, as we think about World AIDS Day, it's time to renew our call to do better. It's time to step up the investments, innovate, ensure we have resilient HIV services, and start to integrate this into the broader health services under UHC umbrella and primary care. We must renew our fight to end AIDS using these innovative approaches. And with that, we need to protect and engage our frontline workers so they can continue to do the good work that they're doing right now. So with this and a few ideas about the way forward, and I think you've already identified many, many more, I'd like to say thank you very much for inviting me to your meeting. And I look forward with engaging with you as we move into 2021 to actually make some of these innovations a reality for every single country in the region, and so that every person has access to what they need in a person-centered approach. Thank you very much, and have a wonderful World AIDS Day. Back to you.
Thank you, Dr. Doherty. So this brings us to the end of our session today. And before I close, I would like to say that we have taken careful note of all the comments and the guidance that everyone has provided in this excellent virtual session that we had today. I would like to thank, on behalf of my RD and on my behalf once again, the honorable ministers who took time to be with us today and to give us their valuable guidance and comments on the pressing issues that we have with regards to not only HIV/AIDS, but also of the current pandemic that is impacting on everything. I would also like to thank our partner agencies, people who work with us every day, for giving the support and being with us today to share your thoughts and your guidance to us on how we go forward. I also want to thank all the other participants who are on this virtual platform listening to all the speakers, although they are not speaking themselves, have been listening on this, and I would like to thank them for their time and for being with us. Finally, I would like to thank our colleagues here, Dr. Mukta, Dr. Rewari, Dr. Sunil Bal, and Dr. Doherty in headquarters, along with our ICT teams who have enabled us to have this excellent virtual session today. So with that, I thank all of you once again, and I declare that this session is now closed. Thank you.